Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Nearly every local authority in England is planning to raise council taxes in the coming year to provide care for people who are elderly or disabled. From April, council tax could increase by nearly 5% in the majority of authorities. But the Local Government Association says that won't be enough, and it warns there'll have to be deep cuts in other council services. There are 151 councils in England. 147 of them plan to raise council tax specifically to pay for social care provision. Our Social Affairs correspondent Alison Holt reports now from Surrey.
Hello, Margaret.
Hello.
How are you?
Bored?
You're bored. This is where the pressure on the social care system can at times be seen most clearly.
And I know you're desperate to go home.
Yes, indeed I am.
81-year-old Margaret Williams has been in hospital since she had a fall, but is waiting for the care she'll need to help her cope at home. And it's social workers in Surrey who are trying to arrange that for her.
Because I've been in here for how many weeks, so obviously I'm going to be weaker.
Yeah. So we think you need somebody to come in at least 4 times a day.
Yes.
In a busy hospital, she knows her bed is in demand. But for the council, finding funding and companies to provide home care can be difficult. When I met her, she'd been in hospital for more than a month.
Since before Christmas. And then they sent me home, but I had to come back in 2 or 3 days, and I've been here ever since.
Just following up regarding Margaret Williams, which we are waiting for the joint funding.
Social workers were able to get the care Mrs. Williams needed a few days later. But according to today's local government survey, most councils are struggling with the sheer demand for this sort of support for people in care homes or their own homes. In Surrey, they say the demand is unrelenting.
I've worked in adult social care for 20 years and I've never known the pressure that we've got now. And there's no simple solution to it. People are getting older, people are living longer and their needs are increasing with more complexity.
And Surrey's chief executive believes they have no choice but to raise council tax to meet the growing costs of social care.
We're struggling to balance next year's budget, and we're really struggling to balance and make it sustainable over the next 2 or 3 years. I think our services are at breaking point.
Surrey's Conservative-led council abandoned plans to ask voters for a 15% tax rise after what were described as government reassurances. But like most authorities in today's survey, council tax here is likely to rise by nearly 5%. And many councils warn other services like bin collection and road mending may still face cuts.
There has been a united voice of local government to say that they need to have more funding into social care and that the crisis in social care is immediate now.
Right, so I've got to get out. Yes, and you'll be fine.
But the government says extra money is already being put into social care, particularly services like this which help people regain some independence. It also says local authorities will soon be able to keep all the money raised by council tax and business rates, giving them more control over their spending. Alison Holt, BBC News, Surrey.
Well, meanwhile, NHS trusts in England have reported a deficit of nearly £900 million in their latest figures. That's way above the expected £580 million. The service has been under severe pressure this winter, and trusts say the figures reflect a larger than expected rise in numbers attending accident and emergency and in hospital admissions. Well, I'm joined now by our health editor, Hugh Pym. Hugh, talk us through these figures.
Well, Rita, we've all got rather used to seeing how much red ink there is across NHS finances in England, and today we learned a little bit more. Now, ministers say progress has been made on cutting expensive agency staff bills, but even so, the figures are worse than expected. So what was predicted last November by the regulator NHS Improvement for this financial year for all trusts, hospitals and so on in England was a deficit of £580 million. Today we've learned it's going to be higher. They think for the whole financial year it'll actually be nearer £850 million. Now, one of the reasons they give is the sheer number of patients, more than expected. Let's look at the numbers going through A&E between October and December. That was a key barometer of patient numbers. and there was an increase on the same period the previous year of 200,000, up to well above 5 million. So that was one reason. Another reason given is the delayed transfers from hospitals, making it difficult for hospitals to actually find enough beds. If you can't move a patient on, then you can't find room for somebody who needs routine surgery, and that means hospitals lose income. Why could they not move some of these patients on? Because of lack of social care in England, as we've been hearing earlier. So social care, again, has come back to cause problems for the NHS in these figures. All eyes will now be on the budget. Ministers, we're told, are working on a new package for social care in England. The NHS will be watching that very closely.
OK, Hugh, many thanks.
Now, a bad day for the NHS. Trusts are overspent by nearly £900 million as the British Medical Association warns England's health service is at breaking point, with a decline in the number of hospital beds leading to delays and cancelled operations. Our health and social care correspondent, Victoria MacDonald, has been to Bassetlaw, where the children's ward will close overnight because there simply aren't enough nurses.
Last Wednesday, Emily Fedderson was rushed by ambulance to Bassetlaw Hospital. She had a high temperature and was fitting. But after being stabilised, Emily was moved to another hospital because the trust now closes its children's beds overnight.
Once she was stabilised, what would normally happen, because we've been to the children's ward at Bassetlaw on quite a number of times now, she would have been wheeled along the corridor, nice warm hospital, to the children's ward at Bassetlaw, but instead we had to wait for an ambulance to come down from Doncaster, and then she was taken out into the cold in the rain, put in the other ambulance, 20 minutes drive, back out into the cold and the rain to then get into the children's ward at Doncaster.
In fact, these are the pictures her mother Victoria took that night as the 5-year-old was being transferred. Heartrending, but they make a point. This is the impact of decisions like these.
The hospital insists this is not about saving money, that it is all about safety. Safety why? Because they don't have enough nursing staff. They are meant to have 12 paediatric nurses. They have 6, and last time they advertised the post, only 1 person applied for the job.
Be they staff shortages, too many patients or not enough money, the pressures on the NHS in England are virtually year-round now. Today, the British Medical Association released a report on the number of beds in England's hospitals that have now closed. Their analysis says that over the past decade, the number of overnight beds has fallen by 1/5. That is the equivalent of nearly 36,000. The Department of Health disputes this, saying it's 15,000 over the past 6 years. And they said the way of counting beds was different 10 years ago, so you can't compare like with like. But what the two sides do agree on is that the numbers of patients just keep rising.
What we see is a system that is gradually and yet inexorably and horribly going off the rails for individual patients who find that they're not able to get what's promised in the NHS Constitution, comprehensive and universal care at the time they need it.
Nobody disputes that the NHS is under intense pressure and that this has been a very difficult winter. But today there came more bad news with the announcement that trusts across England are nearly £900 million overdrawn, and that we aren't even at the end of the financial year yet.
While the figures from NHS Improvement are better than they were for the same time the previous year, they reveal intense demand for emergency treatment in December, along with significant delays in moving patients back into the community. Bassetlaw has said they will try and reopen the ward in the autumn, not least because it's costing them £3,500 a week just to transfer the children. But for the parents, of course, it's about so much more.
For us, it's 40 minutes to a hospital when we could be 15 minutes away from hospital. I mean, we're back and forth. My husband comes up to the hospital, then he's back down to see our other daughter. It adds time, it adds expense. We've got a perfectly good children's ward. We want it back.
Victoria MacDonald reporting. The Vice President.
Now, it is perhaps a sign of the financial demands on the NHS in England that there is an overspend figure built into its budget. But the figure for the whole of the financial year has already been passed in the first 9 months. The plan for overspend was 580 million, but at 886 million, the NHS trusts are already more than 300 million over budget, or over budget, as one should perhaps say. But even with that overspend, the NHS struggled to cope with demand. Nearly 5.5 million patients visited A&E in the last 3 months of last year, 200,000 more than in the same period the year before.
Under pressure as never before. More patients, more cost, and NHS professionals increasingly concerned. While most hospitals say they've struggled to cope with demand this winter, a senior consultant gave News at 10 this insight into what that can mean.
For the first time ever, I've had to phone the executive on call to say I can no longer guarantee patient safety. This is down to us being completely overwhelmed.
It hasn't cost lives, he says, but it could.
We had no physical space to check whether patients who had chest pains were having a heart attack. For the first time in my medical career, I was scared someone was actually going to die on my watch, and there was nothing I could do about it.
On the day it was revealed that NHS trusts are still hundreds of millions of pounds overspent, this busy hospital in Essex, like others around the country, was trying to balance patient care with hitting government targets.
That balance is difficult. We have to make sure that we're as efficient and as productive as we possibly can with the money that we have. But most importantly, we have to make sure that our patients are safe, and that's been a real challenge over this winter.
Payments to agency staff called in to help cope with increased patient numbers has been one of the biggest costs, and the cancellation of many elective operations has reduced hospital incomes.
Here and elsewhere, it continues to be a challenging winter. From October to December, A&E departments in England alone treated 5.34 million patients. That's 200,000 more than the previous year, and it's pressure that's taking its toll.
This consultant is considering his future.
It's made me question whether I want to continue to be a doctor, to be honest. We can't do this halfway house thing that we're doing at the moment, which is a death by 1,000 cuts.
The Department of Health says many hospitals are working hard to improve their finances, and the overall deficit is down on this time last year, but more efficiencies will still be needed. Paul Davis, News at 10, Colchester.
I've been getting